Recording in progress.
By Kai-Fong too. Class will run over 50-year real trip on a chow. Hello and welcome to today's webinar with eLotus, your leading provider of acupuncture and continuing education. My name is Donna Chow and I'll be hosting and moderating today's class. For over 20 years, we have been hosting continuing educational seminars, and today you are in for a real treat. Why? Because we've invited one of the best Chinese acupuncturists in the country, who is over 80 years old and has over 50 years of clinical experience. He has studied with numerous masters and is eager to share everything he knows about getting the best results with acupuncture. Today's webinar is Ashi Points for neck and shoulder pain, master lessons of over 50 years, presented by Kai-Fong Tu. Class will run from 9 to 1 p.m. Pacific time, and we will have one break. Now for important details about the class, about the chat room, about the questions for our instructor, and your CEU quiz. For the chat room, if you can do this now and set your chat preference to everyone so that way all attendees can see what you're typing and be part of the conversation. For questions for our instructor, please type your questions into the Q&A box. And for your quiz, it will be available the following working day, and an email will be sent to you when it's ready. Our speaker today is Kai-Fong Tu, who specializes in the treatment of sports injuries and traumas to the muscles and bones. With over 50 years of rich experience and knowledge, patients can often see immediate results and quickly recover from pain. He was a professor of the Chinese Academy of Traditional Chinese Medicine, Orthopedics, and Traumatology, a member of the Chinese Pain Society, a licensed California acupuncturist. So let's go ahead and begin and welcome our speaker. Today's class is set up a little different than usual. Mr. Tu will speak in Chinese with Tina Chen translating. This experience will be similar to studying in a TCM hospital in China, where you will have a translator and will be able to observe everything the teacher does in the clinic. Unlike most TCM doctors who are reluctant to share their secrets unless you are a member of their family, Mr. Tu is eager to share everything he knows because he shares our vision of bringing TCM to the Western world. We have never hosted a class like this before, so please bear with us as Mr. Tu speaks slowly and can't hear very well at his age. So today he will summarize the essence of acupuncture with pearls here and there and show you what to do so you can see and learn exactly what to do to get the same immediate results. And the best part about this is that today's webinar is recorded, like all of our webinars. So if you miss anything or anything that you want to watch again, you can review it during the video replay, which will be available the next working day. All right, guys, let's go ahead and welcome Mr. Tu.
Good morning, everyone. Testing 1, 2, 3. Can you all hear me out there? Please type in yes into the chat room if you can hear me okay. Yes, yes, yes. Wonderful. All right. So welcome to today's very interesting class. This is, like Donna said, the first time we have ever held a class where we do a simultaneous translation and also a demo. So it's going to be hard on probably me the most because I haven't done this in a long time. Usually we have a class in Chinese first and then we translate it later. But then let's see how it goes today, okay? If I goof up, please understand this is first time in a while. And thanks for your understanding. So before we start, can I have everyone type into the chat room for me where you're from? And then also how long have you been practicing acupuncture? Dr. Tiu would like to know like what level of practitioners we are teaching today. So please type into the chat room where you're from and the number of years you've been practicing acupuncture. 加州5年，圣地亚哥14年，28年、40年，三藩市、圣地亚哥15年、20年、15年、25年、5年、10年、10年、5年、2年、30年。哦，美国的比较多，大部分都是美国的。10年、19年、6年、20年、4年，哎呦，25年、13年、1996年、10年，然后很多老鸟哦，今天不错，9年、1年，还有一个瑞典的18年、7年，加州12年、22年、10年、10年。All right, very good. We have a lot of advanced students today. So, well, I say students because I feel like I'm always learning because there's just so much different types of style of acupuncture and herbs, and I think we can never finish learning. And today it will be very exciting because it's really my honor to have our family friend Dr. Tiu here with us today. He is, I don't know how old, but above 80, so he's been practicing for 50 years, and he and I, and also Grace, she's also an acupuncturist. She'll see her later on. She's the Chinese class coordinator. We are in his clinic, following him in his clinic and seeing patients with him. So we've put together these lecture notes already in English so that we will save time. Instead of having him talk about all these theories and his points, we have already condensed them into the PowerPoint lecture that you have today. So the most important thing today is for you to watch the demo and then also grasp the key points that he has learned throughout his career from different teachers, so that you can hopefully integrate his method into your practice for those patients that you feel are difficult to treat or does not respond to whatever style you're using currently. Okay. So today's class is the first class. We're going to talk about the neck and shoulder. On March 8th, we will talk about the back and hips. And then April 27th, we'll do arthritis and joint pain. And if this series work out well, we will work with Dr. Tiu to see what other type of pain we can talk about and that he can demo for us. Because I feel like, theory is one thing, but practical clinical result is another. And that's what we want. And that's what the patients want. So that's why, when we search out speakers, that's what we focus on the most. Okay. So let's see what else. So let's get started today. I'm going to go over the introduction and the basic points important points of key concepts of his method. And then we will jump into the demo. Okay, so let's go to the lecture notes. I put this slide first. It should actually be at the end, but you can take a look at it. Why is a practice called a practice? And I learned this from a very old doctor. He was teaching one time and he told me that a practice is called a practice because we are constantly practicing until you get the craft perfect. We are always still practicing. And Dr. Tiu was telling us that we have to learn this because we are the bridge between his generation and the next generation of practitioners. So whatever you learn today, later on, please set the stage for the future generation so that they can elevate themselves in their practice. Okay, now the overview today is we're going to go over the key points of his style of acupuncture, and then we're going to do demo, and then we will do the Q&A, and then he has some advice for new practitioners. But it looks like we don't have a lot of new practitioners in the room today, so it'll be great. Okay, so when you first started, or when I first started, when we all first started, there are so many different acupuncture styles, right? There's all the ones that I listed plus more. And pretty much we try to search out the different types of teachers who are proficient and very good in the different styles and have them teach what they feel is most effective. And Dr. Diao here, he learned from many, many different teachers. Just before class started, we asked him how many teachers he has learned from. And he said, oh, too many, countless. He started in the 60s, 70s, and then really learned a lot in the 80s. So 60s, 70s, 80s, he visited, I don't know, maybe some 50 plus different practitioners all throughout China to try to learn from them. Some will teach, some will not teach. So finally, at the end, Ashi point needling is what he finds to be most effective, easiest to learn, because the patient pretty much whatever pain you're treating will be gone in one treatment. And the difference he was pointing out earlier is that some of the styles, when you needle the patient, when they leave, the pain will come back. And then they had to come back to your clinic for another session, then you needle again. So it's a gradual improvement. For his style, he feels whatever he's practicing now, in one treatment, you can pretty much get rid of the pain. Patient will feel some soreness, and some distension after the treatment, but it will gradually get better and then they don't need to come back. So he usually jokes with me that he doesn't see too many patients. This past Tuesday, when Grace was at his clinic, we saw a patient that he saw last time, and last time was 20 years ago. So this is not good, very good for clinical business, but it's very good for treatment effect. Okay, I'm excited to learn. I have seen some of the patients with him in his clinic. The style is very Chinese, if you know what I mean, meaning it's not like Japanese acupuncture where it's superficial and very painless. It's actually a pretty painful treatment. For myself personally, he has treated me. I felt like it's very typical of Chinese style acupuncture. Okay, so let's go to the next slide. Okay, so learning from a Chinese sifu, how is it different than learning from a English speaking sifu? I think most of all the Chinese sifu, when you're learning from them, they expect you to start from the bottom, sweeping the floors, doing very repetitive things until they feel like your character and your integrity and your tenacity is up to their standard for them to teach you something. So that's why it takes really a long, long time to seek out a doctor, and also for a doctor teacher to seek out a student. So I feel we are very lucky today because the timing is actually very perfect. Dr. Tiu is a family friend, and also he is nearby, and also he is near retirement. So he feels like he wants to teach everybody everything. And instead of teaching one by one, like for us to go to his clinic, we could do this through the web. And many more of you can learn. And I think that is more beneficial exponentially because you guys can all see so many more patients. And then earlier I was asking him if it's a possibility for you guys to come learn in his clinic. And he said, definitely, that is fine. You can bring your difficult patients in, or he's open to going to your clinic to help you treat too. So it's something that if you're interested in, you can contact me and I'll hook you up with Dr. Diao about that. Okay. Robert, you're funny. Chinese sifu will slap you. Yes, you're right. But if you marry into their family, they'll teach you all the secrets and they will not slap you. Okay, anyway, next slide. So here what I was saying, Dr. Diao learned from different teachers, and he was telling us that I asked him, so what is the most important when you want to learn from a Chinese teacher? How do you get them to teach you the real stuff? And he said, yeah, that just means you have to pay them, okay? So he said, from the 60s, 70s, 80s, didn't cost that much. I remember when I went to China with my dad in the 80s, he sought out this very famous Tuina master, and he paid the guy $100 a day to learn from him. And at that time in the 80s, the government didn't allow anybody to have an outside job other than what they do regularly. So he had to the guy had to sneak out of the house saying that he's coming for tea in the evening, but really he was coming to teach my dad how to do the tuina. So that $100 a day is equivalent to their 1 month salary. So the guy was very happy to teach whatever he knows, But then nowadays, the cost is very different. Nowadays, Grace was just telling me one of the famous doctor in China teaching Master Dong's acupuncture is like $10,000. I don't know for how long. One week, one session, or one class, or one one session. So one session probably includes some, like a big class and then maybe some practice demo. So anyway, that's beside the point. My point here I want to get across is Dr. Diao learned from many different teachers. And this is what he finds most practical. And that's what we're going to teach today, or he's going to teach today. Okay, so let's jump right into it because we have arranged several patients models because we feel like this is the best way to learn is through watching him practice. Okay, so let me just go over the key points that we have summarized for you, from learning from him. And then you can go back always to look at these key points. Now, number one, before we start, he said that 90+% of the patients with pain coming to your clinic are suffering from soft tissue issues, soft tissue. Nothing really is wrong with the bone, dislocation whatsoever. Most of the time, we're dealing with soft tissue. Okay, so remember that. Now, what we want to do is use this technique to relieve soft tissue pain. And so number one, when you start seeing the patient in your treatment room, you want to first ask the patient to identify the most painful point or area. So from that area, number two, you want to palpate for any kind of hardness or any kind of cord. I remember Dr. Tan talked about palpating the skin, like pinpoint one point where it's most painful. And then he will take the imaging, right, from where it is and needle accordingly. He does this no needling. But for Dr. Diao, he doesn't. He will actually palpate and find where it's the hardest and start there. He doesn't do any distal needling. It's all local. So number two, after you palpate for the hardest point, number three is you hold that point with one finger. Okay, and don't let go. He said that repeatedly many times. The needling hand usually for us is the right hand, but the left hand, he said, is the most important. The more important hand is the left one because you want to hold it and you want to make sure you know where exactly it is you're needling because he says that the tendons will shift or the pain point. Okay, so number four is you take the other hand and you needle right into that point that you're holding. So that's very important, okay? Don't forget that. The location hand is more important than the needling hand. So number five, in order to achieve clinical result is you have to have the qi sensation. So if patients don't feel anything, they're not going to have any result. Okay, sounds good? Any questions here before we move on to the next slide? Okay, the next slide. Okay, so we ask him, so we're looking for this Ashi point or not, or any kind of hardness. Now, if we don't find any, then what, Then he said that if you don't find it, you need to expand your area of search slowly to find one. There has to be one. Okay, so you expand the area until you find the knot. Okay, so remember that. We will probably see that today too. Number two, needling hand is not as important as the hand that stabilizes the needle. So the hand that you found the knot, that hand and where your finger is going to be where you'll be needling. So it really looks really very easy when you're just observing him needling, but really there's a lot of kung fu underneath that because whatever he's feeling and however deep, and also you can watch the angle and also the manipulation technique. So all of that come into play. So that's why, you practice after you learn all these principles. So another thing here under number two is that he says the tendons tend to be slippery. Okay, so don't let it slip out of place. Hold it in place and needle there. Okay. Number three, use a gauge 30 needle because we need to get the strong qi sensation. So what if your patient cannot stand a gauge 30 needle? What do? Let me ask him this question. I mean, does he ever have patients who complain and then, 很多老外的病人30号太粗了。32。对，太粗的嘛。那用32。可以用到32。那如果他们觉得32还是太粗呢？ 那可以用36、38，然后叫他们多来几次吗？I asked him, can we use 32, 34, 36? Okay, so the thinness is 32. He doesn't use any thinner than 32. He said Caucasian patients, okay, 32 because they're more sensitive. Chinese patients 30 because their skin thicker. 哦，36你也有用到36吗？
我没用。
哦，OK。
老外没用过，老中没用过，老外试试看。
So he said you can try using up to 36, but then the effect is not going to be there nearly，就是效果不会那么好就对了。
也不一定。
也不一定吗？
你扎酸痛就一定有效，不论你那个32、36。
好，我知道了。
反正36你有酸痛
就可以。
就有效。
Okay. So, he's saying that if you are able to elicit the 得气 sensation, the soreness, the 得气 sensation using a 36 gauge needle, good for you. That's the best. But if you cannot, the thicker the needle, easier to, get the sensation. Okay. Next. Number 4, wear gloves. He wears gloves when he's needling and palpating and pulling out needles because he does a lot of bloodletting. So we will see some of that today as well. And, with blood, you just want to be more careful. So wear your gloves. And then number 5, how many needles do you use? Many people advocate 1 needle, 2 needle, 3 or less, whatever. And Dr. Dell says you basically have to find the knots and use as many needles as you need to relieve the pain. So some patients will have 1 knot, some might have more. And then, so basically you can decide however many you want to use based on how many you find. So there's no, you have to stay below 3 needle or 5 needle restriction here. Now, number 6, sometimes when you work on one area, he said, the pain seems to be relieved, but then the patient will say, oh, it's better, but then there's still a little bit more. So that means that you have to expand the treatment area. So you need to search out a little further to find the secondary areas to work on. So usually he'll tell the patient lie back down and then palpate for more nearby areas and find the problematic, spots to treat. Number 7. So 得气 sensation is important when you feel and touch the knot. So you need to move it up and down to break it up. So meaning using the needle to move, to stimulate, and to break up the knot. So he will show you this when we do the demo. Contraindications. Pregnancy. Okay, so during pregnancy, you don't want to needle the points on the back, and he doesn't needle anybody 8 months or more. And then number 2, he doesn't needle the thoracic points because of pneumothorax. So anywhere near the Gaohuang points, he doesn't needle. And cupping, he does a lot too. So he told us that when the patient is afraid of needles, first what you want to do is work on the local area by using cupping. So the patient gets more acclimated. They feel like that area is worked on. And when you needle them after you cup them, it won't hurt as much. Okay, so when do you do bloodletting? When do you not do bloodletting? So he said that when there is no obvious pain or no obvious knot that you can find, you can do bloodletting first. And then after that, you can look for the Ashi point or look for the knot. So this is a very important point. When do you need to bleed? Do you bleed all patients, or what is the general principle? So usually he just does needles, but if he doesn't, like this says, if there's no like obvious 1 point pinpoint area of pain, or there is no knot that he feels, then you go in with the bleeding. And he usually does the bleeding with the cupping. So we will see that as well today in the demo. Okay, so other couple notes on when to bleed. So some areas where it's hard to needle, you can use bloodletting is a better option. So for example, Gao Huang Xue, in the thoracic area in the back, he likes to do the cupping and bloodletting. The fingers and the toes is very painful, so he will do some bloodletting. This is to release some of the tensions in the tendon and the fascia and to get the circulation going. He feels the effect is better than needling. Okay? Tips on bloodletting. So when the case is severe, also he will bleed first and then find the hard spot to needle. So 2 key points. One is when you don't find any obvious pinpoint area of pain or no obvious knot, you bleed first. And then second, if it's really severe, then you bleed first. Okay. And then another tip is use disposable cups. We will show you the disposable cups. I think you can buy them from many different suppliers. Dongbang, I think, sells them, the Korean supplier. They have the disposable cups. And usually what he does is he tells the patient to buy those cups. And then they'll go home with the cups and sanitize it themselves. And next treatment, they'll bring it and use those cups. So everybody has their own cups. And then make sure you wear gloves too. Okay, contraindications when you're bloodletting. Patients who are on blood thinners and diabetic patients, we want to not use bloodletting. But if you have to, if the case is severe, just bleed a little bit. Okay, so I think that's all. I will leave this question after we come back from the demo. And before we start the demo, do you guys have any questions? You can type it into the chat room or into the Q&A session. And let me ask him now before we start the demo. Okay, let's see. So Dr. Tran says, since the treatment is aggressive, will the patient have more pain after a session a few days later? How does he recognize when it is too much for the patient?
你看那病情怎么样那个严不严重？每一个人都好像有一点不一样了。对你有些严重，有些没那么严重。它没那么酸痛就可以了，不是扎下去没那么酸痛就可以了。有减轻就不要就可以了，也不是要太过头。过头反而脾气很痛。
Okay, so he said that the treatment, is aggressive. So patient will have pain after a session. So when they go home, they'll still feel sore, but then they'll gradually feel better and better and better. So it's not like the other treatments where the patient goes home and the pain returns. Now, also, the second question, how does he recognize it when it's too much for the patient? So he says you want to start stimulating to get the qi sensation, and not to a point where the patient cannot tolerate it, obviously, right? So as long as they feel like they feel the soreness, the qi sensation, and then, they feel improvement, then you can stop. Okay, any other questions? Do you bleed chronic deficient cases? 病人是虚的话可以放血吗？虚的病人。
最好不要。
Okay, so Tim, your question on can we bleed chronic deficient cases? He said better not. Okay, Phyllis asks, if there is a very strong reaction to cupping, is it okay to needle that spot? What do you mean very strong reaction to the cupping? Do you mean the skin turn purple or have blisters? Is that what you mean by strong reaction? Or very painful, after cupping? Can you write it in the chat room? Okay. So he doesn't use fire cups, by the way. He uses the suction cup. Okay. Dr. Wang says, how young have you used this type of treatment on? Meaning children. 这种扎针的方式啊，这种扎针，小孩几岁才能开始这样子这么痛的扎？
最什么？最小啊？
最小的小朋友，你治过的？
小孩子你10岁以上了。
Okay, above 10.
太小他也不给你扎，呱呱叫。
Below 10, they will not allow this kind of treatment. They will just probably scream and run away. Okay, does he ever use heat to relieve the soreness after a session? 就是治完病之后有热敷吗？
不需要的可以。
Yeah, you don't need to do heat session. Okay, so 刚刚他说那个就是拔罐之后，如果拔完是非常紫色的，这样子还能扎吗？
非常紫色。
这个拔完之后啊，罐子拔完之后，皮肤变得是紫色的，就是暗紫色的，这样还可以扎针吗？
有痛就可以扎了，有痛点就可以扎。
Yes, Phyllis, if you after you cup, right? That's when you try to find a knot, and then also try to find a pain spot. So if you do find the pain spot, yes, you can needle. No needle retention. Oh, yes, needle retention. 这个针要留多久？
他怕扎针的时候不一定要留。
OK，
他有酸痛，
就可以了。
他很紧张的怕的，就拔出来就好了。
OK， 等一下，我先翻译一下。So those who are afraid of pain, afraid of needles, you know, you can just needle them, and then you get the dirty sensation, then you remove the needle. No need for retention. But if you're going to retain, 如果要留针的话，留30分钟还是40分钟、20分钟？不需要。
他是留针，通常留一阵子就可以了，不留不需要了，留一阵子几分钟就好，3几分钟就好。
为什么不需要留呢？
反正有酸胀、秋乳效，你多留在那边都是花时间，都是作用不大。
Okay, so he says the most important part, okay, guys, is to get the dirty sensation. If you want to help sustain that sensation longer, leave it for a few minutes, 2 to 3 minutes. That's enough. You don't even need to do it for 10 minutes, 20 minutes, 30 minutes, not at all. And I asked him why not, and he said, that's just so the patient can relax and, you know, maybe fall asleep in your treatment room. But it's really not necessary for treatment result.
其实呢，不留针仍然有好处。你拔出来以后，不留针，拔出来等一阵子再重新找那个地方，看还有没有痛。假如还有痛，重新扎一次。
Okay. So he said the advantage of not retaining needle is after you pull the needle out, the patient can tell you immediately how the pain is. And then if there is still something there, you need to go back to check and find more knots to do another session of needling, just to make sure you get everything. 好 Okay, let's see. Next question. Lots of persistent shoulder pain after COVID vaccine. Would this be treated differently? 有一些人打那个疫苗，打完了手很痛，有没有？这种可以扎吗？
可以。
Yes, Thomas. Yes. 所以还是一样，就找他最痛的地方扎。Okay. So yeah. So find the most sore spot from the COVID vaccine, and then use this technique there. Okay. Any other questions? Let me go into the Q&A box here. Okay. How long of a needling sensation should be experienced by the patient? 32 gauge is bigger than 30. How strong of a needling sensation should be experienced by the patient? Well, it should be a strong sensation, but not to a point that is intolerable. So I suppose they will tell you if it's too painful, that they cannot tolerate it, and that's when you would ease off. Next, what area do you bleed when there's no obvious knot? 他说啊，你在找不是要找一个痛点吗？或是找一个硬点吗？如果都找不到的话，你是要放血放哪里？就是放那个大概那个区就对了吗？
找不到痛点， 他还是有最痛的地方就可以扎了，
OK，不是扎放血，放血。
风水也可以，
那
也
OK，
可以，也可以，就是那里最痛的地方放血，
他如果是没有很痛的，假如说他说这里痛，但
嗯，
是没有说一个地方很痛，那你也找不到有一个硬点，那你要放哪里了
还会找得到了，你慢慢找会找得到，不
？I
会
asked
找不
him,
到。
"Will you have shoulder pain?" But it's like a general shoulder pain. There's no one specific area, and there's no one knot that you can find. Then where do you bleed, right? He said, "Keep looking. There is a knot, or there is a more painful point than other points. So that's where you would treat." I guess that's where the kung fu is where finding that knot. Okay, next. Can he show us a bleeding demonstration? Yes. With regard to post-treatment pain, for how long? Several hours or several days? 哦，他说治疗之后病人会觉得酸酸痛痛的嘛？这个是持续多久？几天还是几小时而已？
你一个人都不一样，有时候回去以后1-2个小时就没有了，有时候一天都还有。
Everyone is different, he says. Some people will experience, pain and soreness for a couple hours. Some people, even after a day, they will still have it.
有酸痛不要怕，酸痛过后就好了。
Yeah, so tell the patient don't worry about the soreness and mainly the soreness and swelling sensation, because after that your problem or the pain will be completely gone. Okay? Let's see. Any other results with frozen shoulder? 他说那个50间啊，效果好吗？
比较麻烦一点。
Frozen shoulder is harder, he says. Robert, he's a very honest practitioner and answering very frankly. Yes, he is totally very honest. He's not like the traditional Chinese doctors that I usually have to learn from, where you ask 10 questions, maybe they'll answer one, or maybe they'll answer something completely unrelated. He is very funny because I told him, we have this class for 4 hours, so maybe we'll find 2 patients. He says, "What? Why only 2? That's not that we need more patients. The more the merrier, and you guys can learn more because I will finish really fast. You don't need 1 hour for a patient." So we will have 6 patients coming today. All right. Thank you. Can the patient put heat on the point to relieve the soreness? 病人回去的时候，如果还会酸胀，他可以自己热敷一下吗？
冰敷。
冰敷哦。
对。
Oh wow.
这个不是热敷。
Oh wow. He said use ice, don't use heat. 哎，廖医师，中医不是说不能用冰吗？I asked him, isn't ice like contraindicated?
跟扎完很痛，动急性。
Okay, so he says we use ice because, after needling, it's like a micro trauma again to that area. So you use ice to relieve that soreness and swelling.
动急性就冰敷。
急性的，当做急性的冰敷。
对。
好。Yeah, and I know. Oh my God, is what I said too. Ice. Okay. Any other questions before we start? No? Okay, so let's go get on to the exciting part of the class. We'll take a little break, a 10 minutes break as we set up the treatment room and then get ready for the demo with the camera and the patient and everything. Okay, so 10 minutes, let's come back at 9:50. Thank you. 好。
Recording stopped. Recording in progress.
Okay, so before we start, is everyone back? Now we're gonna do the demo session now, and Dr. Diao said that he never needles anybody sitting down because of fainting needle. Okay, so everybody lies down. So we have our first patient. She has shoulder pain. So she told us earlier that the pain is here, right, Christina? In here, on the both sides. So Dr. Diao will start by palpating and examining. OK， 好，廖医师可以开始了。
哦，
你就讲一句，我给你翻一句，这样子。
先摸一下，
So touch first. He's wearing gloves.
还好。痛不痛？疼
You okay?
疼
Do you feel
Huh?
pain? Yes.
疼疼，
Yes.
这边呢？这边。这边疼，
Yes.
这个。疼。
Patient said yes. Yes.
疼
Yes. Yes.
疼。这个如果结在这边，
Okay, he feels a knot right there.
那个结很硬的结，
Very tough knot.
这边也有。
And another one here.
疼
Do you mind if we
Okay.
draw on you? It's okay. Make a mark. 我来拿一个笔来写。哇，
这边比这边严重，这边没那么重。疼
This side is not as painful.
喏，疼
要不要画一下？
啊
找到的地方画一下。
哦，这边没那么痛。
This side is not as painful.
都有两
So
边
she
都
said a lot. He said a lot of knots.
Yeah.
Wow.
这边疼
And over here is another one.
疼疼
Yes,
Huh?
pain there too. Yeah.
疼
Yeah, she just twitched. 雕是这样正常吗？就是这么多痛点啊，这么多硬点呢、
一般都有那么多啊。
Yeah, I asked him just now, is it normal to have so many knots? And he said, yes, normally you have that many.
这个
Yes, pain.
这个很疼，这里
How
疼
about here?
啊？
Not really. 没有
有没有痛？
Not really.
哦
不会。那病人如果说不痛，但是您有觉得有硬点的话，这样是扎还是不扎？I asked if
他
they,
不
等一下，等一下。I asked if patient says there's no pain but you feel not, do you needle or not?
可
要
摸起来有，
摸起来有，但是它不痛，这样是要扎还是
也可以
不要扎？
也可以不扎，也可以扎。
Oh, he said it's up to you. You
可以
can needle or you
有
don't have
扎
to
也
either.
会很舒服。
If you needle, they will feel very good. One more knot. Wow, 这也太多了吧？ That's a lot.
太
1, 2, 3, 4, 5, 6, 7, 8, 9. Pain, yes.
疼。
Yeah, pain. Pain. So
这个高
here
峰
is the
啊，
most painful.
高峰
That's the
这
Gao
个
Huang
高
point.
峰
Ladder 40.
很多
something
很多，
But this is 就是这里不能扎嘛，对不对？
这里不能扎
So
八
he
卦
said, he said, don't needle there, around here. You need to do
这
cupping.
这里的要拔罐啊，或者敲几下放一点血。
Yeah, he said usually in these areas you don't needle, you just bleed and cup。
就
OK，稍等一下，我看有没有人有问题哈。Let me see if we have any questions before we start the bleeding or demo. And yes, we needle all the knots as much as the patient can handle. 这里最疼。
这是高峰。
This is the most painful spot, she said. 我把它都擦掉吧，刚刚有那个。
找两个罐子来。
要放血吗？
那个最好还是放一下。
那有放血针吗？
有。
待会儿再放。
对，下次。
Okay, so we are going to cup first and maybe bloodlet later. We'll see.
或者下次要买很多罐子回来。是可以了。
Okay, that's enough. So let her rest a bit.
34也看，30了好了，他不怕。
Yeah, 30 gauge. We'll use 30 gauge. 要扎哪里？
这里。
这里，这里。
这里。
Oh, we're needling here.
这里很硬。
It's very hard.
有个结在这里。
There's a very hard knot.
有个结。
我来给他。你不是要用一手固定，一手扎，还是不用？你已经。
这个不疼。
Okay, so see how he's grabbing.
先那固定。
So stabilize first where the knot, is.
这个后面还有一个。
And then he is using another hand on the bottom. Do you see?
有个结在这边。 固定。
Okay, so stabilize and then needle.
干嘛？
How did you feel? Pressure? 有一点胀感。
干嘛？
You feel soreness?
Yeah, the patient says she feels soreness. So now he's looking and fishing for the qi sensation. Okay, the patient just say, So swelling? Yes, 他说对有。Yeah,有swelling sensation. Is it swelling? Do you feel soreness, Christina? Yeah, 有，他有感觉有。
这个，你要左右找。
Okay, so 左右找是不是？
So
turn your needle to the left, to the right.
硬的地方。
To
针下去有硬的地
find
方，
where
有
there's
松动的地
hardness.
方。
To find where there's soreness and needle there. So this is a stimulation. Okay.
这个地方留一下也可以啊。
Okay, so
不
we'll let
留
the
其实
needle stay there for a little bit.
怕疼不留也可以，
都已经扎进去了。
扎进去有酸状就可以了。
Oh, so okay, here what he said, we don't have to leave this needle in. We could too, because we already got the qi sensation. So we can take it out if we
有
want.
酸胀吗？
So 还会痛吗？
有酸
The
胀
Do you still have swelling and pain when he's pushing?
有没有？
I feel a little bit right there.
Oh, right there.
Uh-huh.
Okay, so a little bit of pain left only right there.
Mm-hmm.
So 这个要角度要换一下吗？还是要再另外一只？
再找一下。
Okay, so there's only a little bit of pain left right now. So he
这个
said,
时候要固定那个结啊。
okay, so he said he's stabilizing that knot where the pain is left.
再找，
Mm.
So use a
Okay.
needle
然后
to look for where the pain is. the knot is. And
I
basically
do, I
what we're
do.
trying to do
Yeah.
is use the needle to break
So,
up the knot. So any swelling sensation, Christina?
Soreness.
Soreness, okay.
酸胀，
有，它有酸胀 yes. Does it feel good, Christina?
It does.
It does, right? I feel like
Yeah.
I feel good too. And I'm not even big needle. It just feels like, right? Like, I don't know, melting the knot.
这个
Okay,
Okay.
on this side. How do you feel? Pain?
Yeah.
Okay,
这个
pain here. So he's palpating for the knot.
这个
So see how his hand is down here stabilizing? So that's one tip, okay, guys? So hold the knot with one hand,
很硬，
needle with the other. It's very sore and very hard, the knot.
酸吗？胀，
Any soreness?
有
No.
Not yet. I
not
may.
yet.
Not yet.
这个
How about now?
有
Yep. Mm-hmm.
Yes.
Mhm.
现在有。
这个呀
Yeah. 有. So all this time he's still holding with both fingers like this.
胀
Swelling? Soreness?
Soreness.
Soreness. 有，会酸。
酸胀
没有胀，只有酸。
酸
Only soreness, no swelling sensation.
Like hot.
Yeah, 有热感. Feels hot.
Mm-hmm. Mm.
有
So 通常就拔出来就好了。
这个
Yeah, normally he'll pull the needle out like
有酸
this.
胀的可以拔出来，
So one more, he feels there. He holds the
Okay.
tendon, stabilize it.
这个很硬，这个
Yeah, it's very hard here.
这个固定，
So
这个是
stabilize with the finger and needle,
这个慢慢下，
and then slowly insert.
日吗？酸
Any soreness?
Soreness.
Soreness 有，
Mhm.
酸胀有，酸没有胀。
酸，有没有？
有。You feel sore, right?
I do. Yeah.
Yeah, 有。
有。这个快，这个针下面咔啦咔啦响的，那个就是那个筋结的，对
Oh,
筋
so
结，
he says underneath the needle, he feels like the kora 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 sound.
对，
So that's the tendon knot.
哦，这个
So all this time,
That's-
do you feel
what
his,
is that
you
sound
see
again?
his finger is still stabilizing
这
there.
个浅，这个是最浅的，
Oh, so this
筋
is
膜
shallow
筋膜
fascia
咔啦
area.
咔啦的，
That's making the sound.
再深一点没有，好像没有，
In the deeper level, there is the sound, only more on the superficial level. So both needles he pulls out now.
一般这个是这个要固定，这个慢慢下去，哦，这个都有，哦有，
Pressure. Mm-hmm. Oh. Uh-huh. That was painful.
That's all. She said that was painful.
痛
Yeah.
一点点都没那个，痛吗？
Uh-huh.
Does it hurt?
Yeah.
Yes. Painful.
固定。一般量过手进去量过手进就没那么痛，寸进，
Oh,
对，这个就好了。
Oh, so he's only doing shallow
啊，
insertion
现在慢慢下去，哦，很硬，
and then slowly because it's very
然后
hard
很
underneath.
酸，
Yeah, soreness.
很酸啊，
Yeah, very sore because it's very hard.
真的下不去。
Yeah, he can't even push the needle in 30 gauge. It's really stiff.
啊，对吧？你看，我
酸嘛 Yes, sore. 他在叫了，就是
Sore.
酸。 So he says, yeah, don't do too much stimulation.
这里很硬，
So one more is very hard here.
寸劲下去啊，进去，哦，哎，很硬，你看，
So very hard too here.
哇，痛吗？痛，哦，你看，
Soreness.
She says she feels soreness. Wow, stiff neck. Wanigan. 看旁边 side. 等一下哦，等一下哦。Let's switch the camera position here so you can see better.
对，这痛吗？不痛，
Does it hurt, Christina? Yeah, 会痛哦。
没痛，
对，这个痛。
地痛，
But did you feel right now?
Yeah, that's
哇，
哇，什么？很硬吗？
soreness.
Yeah, it's very hard and she said it's very sore.
很痛，很硬，
Yeah, it's very hard.
我们是点到那个印，还是要穿过那个印？
要穿过，
So,
Like a-
okay, Grace has asked a question. Do we just, use our needle to touch where the hardness is, or do we penetrate through the hardness? And he said, penetrate the hardness. Okay, so let's take a look at the cupping. Oh, it's pretty purple. 还是挺紫的吼。
这个
Oh, so here's some more. Another painful hard spot. Do you feel sore?
Yeah.
Yes, yo.
Oh,
Very hard, he said.
这个很硬，小心啊，不要太深。
So be careful here when needling. Don't go too deep.
你手下知道了，它那个针在哪一个部位？哦，很酸。结果你看，
So you should know with the feel of your finger how deep you're going.
这个
So 扎完了就再摸摸摸看还有没有，这样就对了。Okay, so keep palpating after you needle to see if there are any more knots.
痛吗？
Any pain?
那里
Any right here?
Uh-huh.
对，这里。Or come this way. No, if he's his hand will block it. 好，待会，等一下。 Okay. So he's holding again with the left hand, stabilizing with the thumb and the four fingers.
伸起来，
很硬是吗？
很酸。
Yeah, very sore. Yes, she says. She says, yeah, yeah, that's very sore in English.
是吧？
Okay.
可以吗？可以。
So how does it feel? Are you okay?
Yeah.
Okay.
可以啊。
Yeah.
You're a tough cookie.
厉害啊
Wow.
I'm walking around like this all day.
Yeah. 还硬吗？还是比较软的？
比较软，
It's softer now,
还
he
是有
says.
软。
But still there are knots.
yeah.
刚才这个扎过，还是很硬，
So
可以
he
重
said
新再
we
扎一次。
needle there already, but it's still very stiff and very hard. So we can needle again.
没那么硬。
Oh, it's not as hard now.
好了，
Do you guys have any questions regarding this patient? You can type it into the chat room. I can ask him. So those 2 points.
不要扎。
So we're not going to needle, but we're gonna bleed those points. So 刁医师，有人问说，您在扎的时候啊，是把那个硬点扎掉才停，还是有得气就可以停了？ Okay, so Christine, he says, your question, does he needle until he feels the knot disappears, then stops needling, or just until he gets the 得气? He said just until you get the 得气. Ah, 等一下好了，我来看看有没有什么问题哦哈。Let's see. Is it possible to do this on oneself? 自己可以自己给这样扎吗？自己给自己扎吗？自己可以给自己这样子扎吗？ He said, how do you do that? So answer is no. Does he use heat and infrared lamp? Okay, 他说你有用那个远红什么那个红灯吗？有哈。Yes, he does. He has one in his clinic. So he's so honest. He said the heat lamp is just for show because it doesn't really do much. Okay, so he's again very honest. I don't know if I should say this, but he says that's pretty much for the patient to feel good that they're getting their treatment worthy of the treatment fee. But really, it's what he's doing that's more important. If you can find knots on your leg, can you do this on yourself? 就是脚会酸啊，屁股酸啊，可以这样自己扎吗？扎得到的地方啦。Yeah, so Ivy, he says, yeah, if you can find knots on your legs, you can needle, you can reach, then yes, you can do this on yourself. Let's see. 还有没有？等一下哦，还有问题哦。Very good. You guys are asking a lot of questions. Fun. Regarding the treatment, okay. Does he needle knots or some of them? Does he needle all the knots or some of them? 是全部有硬点都扎吗？还是有选几个就好了？
就是先扎有痛的，
最硬的，OK， 有痛的，
再扎有痛的，然后其他的也可以扎，
是先扎
也是有帮助。
先扎痛点还是硬点？
这硬点不痛也可以扎，但是首先扎是有痛的。
Okay, so first you needle the more painful spots, and then you needle the knots. And then the secondary knots you can needle if the patient can still stand it, or you don't have to. Because if you got rid of the primary one, they will be already much better. Has he found success with bulging disc issue causing muscular pain? 那个椎间盘突出啊，椎间盘突出这样子扎的效果好吗？好 ，Yes, Mylene very good with bulging disc.
还好。
So with deep insertion. 什么？哦。Okay, Mylene, you need to come to the class in March. Yeah, March 8th when we're gonna do the hip and back to see how he does that. He said you need to know how to do it right. Next question. So during deep insertion, is he going more oblique along the muscle layer? 您在扎这个硬点的时候，是这样子45度角度这样子在扎吗？还是直 ？OK，
角度怎么定那个硬节？
你定了以后，前后左右都可以
都可以，但是是都要还是都可以？
啊。
就是硬点在这里，是再把它扎穿就对了。
扎下去有酸状有硬结的地方，要扎到。
Okay, so my name. So what he's saying is here. Let me show you. So this is a knot, right? Here's a needle. So we're going in. Not the angle in particular is not important. Did you notice that when his needles were in, he was going, like in different directions, looking for the knot, and you want to penetrate through the knot, not just to touch it. So. And also importantly is you need to ask the patient, do you feel the qi in whatever direction that you are trying to dissolve the knot?
最好找到有酸状。
Yeah, so you need to find the soreness and the, soreness and painful point. Let's see, next question. So during the deep, okay, no. So we do not have to twitch the knot. It's more subtle, but with a heavy needle, correct? Many Western PTs now perform trigger point needling. What's doctor's thought on this? Donna, what's twitch the knot?
Um,
你知道吗？有一些病人，他就是你找那硬点，你扎下去，他会痉挛，但会抖。需要找那个反应吗？还是不用？
有抖没关系啊，就有它抖啊。
Okay, so the
有些也会有抖。
the twitch response is okay if it is, but you're not really looking for that. You're looking for the soreness and the qi sensation, the qi sensation. So not necessarily looking for the twitch sensation. So second is 他觉得现在有很多那种 physical therapy 中文叫什么啊 Grace 你知道吗？就做那种复健那种的，那种西医复健的。
复健师啊，帮你做骨头调整。
然后他们现在不是都在针灸吗？您觉得如何？不是脊椎调整，我是说那种复健其实他们不是针灸医师，是西医，他们现在都在扎针，你有听说过吗？还是不知道？Oh, so he doesn't know about the physical therapist doing trigger needling, so he doesn't have any thoughts on that. Okay, so let's go on next with the bloodletting.
So now we're going to show this.
Okay, so what is that?
This is the
Oh, this is the bloodletting device that he uses, the pen.
take out the
So usually,
除非你自己专门自己一支杯可以用。
yeah, so that's great. That's what is this one?
this is the
Hold on a second. Oh, so this is usually the one. Okay, so this device. Have you guys seen it? With this, they put a needle in and you put this cap on, right?
they will
So it's a bleeding pen
the
lancet
needle will be
device.
from here.
So then when you click here, the needle will come through here. But you don't want to use this on patients because the blood will be here, right? You'll contaminate. So you take out this part.
有这个没那么痛。
Yeah, so using that is less painful. But you use that only on yourself, right? So you push this disposable needle to the end.
这个是一次性的。
So this is disposable, he says. So you use this on the patient. He likes to use the pen because it's more convenient to tap.
这个扎下去呢，就比较痛一点点，没关系啊，你这个痛点。这个
So
痛。
So here we go.
嗯，
So you 是不是要先找痛点，还是
对啊。
先找硬点？
先找痛点。
Okay, find the painful spot, Christina. If it's painful, let us know. Okay, here, 刚刚那里有。
Yeah.
Yes.
嗯
Yes.
你要多按几下，多按几下，扎下去没那么痛。
Oh, so okay, here's a little tip for you guys who want to do the bloodletting. He said push it a couple more times on the patient, and then you bleed is not gonna be as painful.
先拔罐，先拔罐，先拔罐也没那么痛。
Okay, so here's the tip. If you just go in and bleed the patient, it's very painful. But if you do cupping first and then poke around with your finger to press around and then bleed, it's not as painful.
然后
Okay?
敲的没多按几下，
So push a couple more times.
对
Like spicy.
Spicy?
Yeah.
She says it feels spicy.
这个罐子呢，最好自己买的，全
So
新的。
the cupping sets, he says for the patient to just buy it from you and then they can take it home.
这病自
So
己
it's disposable.
买完用完以后，给他带回家，
So they can bring it home. 对。
下次要来，
And then
这
they
次
can
要
bring
来
it to their next treatment 20 years
就
later.
就自己带来。
So
就
he
像你这个这个哈，这个呢不碰到针孔
so
也
don't
可以，
so if you don't touch the blood, it's okay
Sí,
to
sí,
use
lo
it
que sea.
repeatedly, but
Pero
it's
te digo,
better not
针
to.
孔，不要碰到针孔。
So don't touch the blood when you're doing bleeding. I mean, when you're doing the cupping.
然后呢，把一点一下出来，
outside 不要碰到
Yeah, don't touch the blood.
这个孔。它
Oh,
打的
don't
孔
oh don't touch the hole where you blood led.
So the
最好还是自己专用的哈。
Yeah, 对对对。
对，
Yeah. You need
他
to
比
have
较
your
放
own
心
cup.
啊。
The patient will have more confidence. Any pain here? Yes, 会痛哦。好Yeah. This one is not as painful, right? That hurts. 会啊，会哦，这里也痛啊。
也都
Yeah, it's painful too.
这个高峰。
这个拔罐要拔多久？放血拔罐。
没关系啊，他有出来，有出来就好了。
I asked how
他
long
那严重的时候要放久一点，他给他多出一点。
how long do
大概
you
10
need
分钟
to
啊
need
10
to leave the cup in there to suck out blood?
10分钟都可以。
He said, if it's more severe, longer, but in general about 10 minutes, 15 the most. 那这个血啊，它会自己停吗？
啊，
会自己停吗？
时间久要时间久一点。
就会自己停了。
对对，大概要超过15分钟，他才自己。
15分钟。
15分钟。
So usually after 15 minutes, the bleeding will stop by itself. There won't be any more blood coming out.
那现在反正有时间留多一点也可以。这个就不是难，因为这个是扎针的。
上面不用放，就这3个位置上面用。
So we don't need
这
to
个可以扎的，这个很硬的。
this all along the shoulder trap area is for needling. In the thoracic area for bleeding and cupping. It's still stiff.
这个
那你拿它就能碰到。
啊，
到。
这个很硬
Hold on a second. 等一下哦。
啊。
You yeah, don't be behind his hand. You won't see.
是买很多罐。
Couple minutes.
下次啊买多一点罐子。
We're going to leave for a couple minutes. So you feel okay? Yeah. All right, that's good. All right.
OK，来，我来问你一些问题好吗 ？You can answer some questions。
有问题。
没关系，在那里可以。有人问说那个笔啊叫什么名字啊？哪里买的？那个放学笔在哪里买的
反正就是公司都有了。
？OK，so 看那个镜头。Yeah. So he said the Lancet pen， 坐着吧，休息一下。The Lancet pen you can buy from any acupuncture supply
买
company。
灯就
来，您坐着，然后看那个镜头，哎。And what is the gauge of the Lancet？ 那个放血针是多粗？
放血中那个盒子带来。
Okay, so we'll show you the box of the Lancet.
它比较粗的，这个是
23 gauge.
23了。
Yeah, 23.
23。
好，23。
23。
Okay，来下一个问题。Next question. If after first cupping and needling, do you have to use the bleeding? What if the patient feels better after the needling? There's no more knots. Do you still have to bleed? 就说扎针如果就已经好了，还需要放血吗？
比较严重的，不是很严重不放血的。
Okay, only bleed the patients who are severe. So if it's not severe, just needling would be fine. 下一个问题 Next question. How do you choose where in the cup area to use the bloodletting pen? Okay, 放血的时候啊，你怎么选要在哪里放？
最痛的地方。
Bleed, use the lancet points on the area that is most painful. So when he was palpating, remember, you guys can go back to look at the video and review the treatment. He's always palpating either to find the knot or find the most painful point. So in this case, where to land the lancet needle is where the most painful points area is. Okay. Why does the cupping sometimes cause water blisters? 他问说为什么有的时候拔罐会有水泡？为什么？水泡。
不要太久。
Okay, it's when you leave the cup in for too long, you will have the water blister.
太久会
Yeah, 太久。Does it work to use fire cups or just use suction? 可以用火罐吗？还是用这个就可以了？
火罐也可以啊。
看那边。
火罐可以，那个火罐其实呢，火罐拔得更紧。
Okay, so
比这个还要好，其实火罐还比这个好。
Fire cupping is better than suction cup, but it's a little more dangerous, but it's tighter. It's better, he says. Next question. If you cup for a long time, will they be cupping blisters? Yes. Does anyone know of a practitioner in Denver? I need this so badly. Jennifer, you can fly Dr. Tiao into your clinic. He is puncturing 8 times per cup. Okay, hold on. Let's go back. I'll answer the questions later. Let's remove the cups now. He said it's time. 来，我们来给您来弄，您给大家表演。So let's see how he removes the cup.
这个
Stabilize with the napkin on one side.
有个多，他们跑了。
The side where the blood is gonna come out. So let the air out first.
先那个放气。
Yeah, so press on the or 这个是按下去是不是？
对，不是拿出来。
Oh, pull it out to release the air. So to release the pressure. And then press with one finger on the right. And then
结果就不会跑到到处都是。
So he has napkin on one side.
对。可以。
您可以慢一点嘛，表演慢一点。I asked him to slow down his demo so we can see more clearly. So napkin on the left, pull up on the orange.
放气了。
Yeah. orange cap,
然后这
and
边
then
钉起来，
press,
放出来。
and then, oh, he's not used to doing it, it's too slow.
嗯 也是，放水，
Release, press. So you're pushing the blood into the cup if there's a lot.
不让它流出来。好，
要再消毒还是不用？用酒精再消毒吗？
最好还是消毒一下，不是有点会有点痛吗？
So I asked him if you need to sterilize with the alcohol again, but it hurts. But it's better to still sterilize it a bit. So 这个就是算一个针
差不多好。
好了，然后最后要做些什么事情呢？
你问他还有哪里痛？
So at the end, I asked him, so now we're
Are you
near the
ready?
end of the treatment. What do you do at the end? And he said, ask the patient, where
Mhm.
else is there pain?
问他有没
So
有
Christina, any other pain, any pain
哪
that
里还
you
有
feel?
痛？
How do you feel?
I feel good.
Oh, can you guys hear? Let me see if you can hear. Can you see if they can hear? She says
I
she
feel
feels
good.
good. Do you feel your neck is a lot looser than before?
Yes.
Yeah, a lot looser,
lot.
right?
起来，
A lot.
起来
Okay.
是这个
Okay, he wants you to get up and then see how you feel. Let me get your jacket for you. Slowly, yeah.
Yeah.
有没有？那里还有没有师傅？
So any
看看那里还有。
yeah, any other areas of pain?
No, nothing.
Nothing?
wrong.
But does it
This
feel
is so-
sore in
this is
general?
sore,
Yeah, it
but
feels
it's
sore
not
from the
like-
treatment.
Yeah.
Yeah.
But not like before it was like a sharper pain. Now
If-
it's just like sore from being touched.
OK，他说之前来的时候啊，
哦
是这种刺痛感觉。他
很紧
现在，现在是就是被治疗完的那种酸痛的感觉，这正常嘛
扎针的地方有酸痛，这
对
正常。
？So he said it's
但
normal
是
to
它
feel
会
the
没那么紧
soreness,
就
yeah,
轻松很多
and it's normal to feel very relief, you know, like
Yeah.
a
it doesn't feel
lot of
tight. It
right,
was,
there's-
like up here before.
right, right, yeah.
它
以前很紧。
酸胀，到下午就更好了。
So he says you're gonna feel this soreness
Mhm.
right now for a few hours. In the afternoon, you will feel much looser and much better.
针口痛，扎针的地方针
So he said the pain you feel now is from the needle heads,
Okay.
so
啊
it's
那
not.
到下午就
So in the
没
afternoon,
酸痛的时候就更好。
yeah, in the afternoon, you should feel much better, no more soreness. At most it will last a day and then you'll be fine. Yeah. 好了吼，就这样子。I said, oh,
问
okay.
他
He said,
问他
hold on.
还有那里不舒服没有？
Okay. Any other areas of discomfort?
还有
That weren't no.
No?
基本
Okay.
上没有了哈。好，低头
Okay.
有
Look
吗？
down.
有没有？低头可以。
Yeah. When you lean forward, any other pain anywhere?
对，还是有一点肿。
So he says it's still a little swollen. 那这个肿是因为我们给他弄的，还是本来就肿的？
它本来就很肿，
Oh, okay. Is it swollen from before? I said, is
都
it
有
from us?
扎到了，都有扎到这个地方，两个地方扎到。
He said we already got most of the spots.
Yeah.
Yeah, right there, right there.
都有扎到了，他们到下午就更好了。
So in the afternoon, you will feel a
这个还
lot
可以
better.
OK OK，
Yeah. I feel better.
还是这里。
So does it still hurt over there on the right? where he's pointing?
No.
No, no pain. Okay.
多好往前，这里还有一点，
Yeah, he still
这里
feels
还有
there's some
有
tightness.
哇
Yeah, but we
这样
already
子都
needle
没
there.
没有更好
It's not as bad.
Uh-huh.
It's really bad.
Yeah, okay.
Feel much better in the afternoon.
这个有加过，这个还是比较
他
紧
是不是要包起来啊？不要穿这个露到风了，吹风的。
我最好保暖呀。
So he said, don't wear things like this to expose your neck area. It's better to wear a turtleneck or scarf
Okay.
because the wind will blow on the, the neck and you gonna get tensed up again.
Okay.
还好我不要再补一针也可以，怕好怕好。
He wants to get you completely well. He said, add one more needle. Face down again. Okay, one more. Dr. Dell's technique is really like, let me get you well and don't come back.
这个
Okay. So feel and palpate. Yes, there. So I think the hardest part to this technique is that you have to be able to palpate the hardness and the knot. Because when I was at his clinic, he says, Tina, palpate here, feel it. And I said, I don't feel anything.
哦这里很硬
Very hard, he says.
哦
How did you feel?
哦
I
呀
feel that.
Yeah, you feel yeah, okay.
Yeah.
Very hard.
一直在那边哦
Mm-hmm.
哦，哎，好了好了，你看都是可以做可以周围找到它硬结哦，
Yeah.
几乎扎不
Hard knot.
几乎扎不进去
Yeah,，he said you cannot penetrate the knot. It's tougher than the needle.
嗯嗯，你看多疼
Do you feel sore?
I do.
Do you feel sore? Yes.
Yeah.
哦。 哦，
Yeah.
好了，
Both the practitioner and the patients are screaming. Okay, good job. You're done. Good, good, good. So just make sure you cover yourself and you're all good. Okay, so let's take a break. Come back in 10 minutes. So 10:50, let's come back. And then we'll answer some questions and then we'll go on to the next patient, okay? This is exciting. 好，休息，喝个水，上个厕所。Thank you，谢谢你。
Recording stopped.